Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. So Henry writes in and he says, my son, he's 34, he has severe cerebral palsy with a tracheostomy and a feeding tube and oxygen. He lives at home with me and he has been in ICU since July the 3rd. He has been on a ventilator the whole time. He's got sepsis from a PICC line and I want to bring him home on the ventilator. I don't know what to do. The doctor said he was going to die 3 weeks ago, but he's still with me. Can you help? So thanks, Henry, for sharing your son's situation. So here is the thing. As you're aware, we're also providing a service, intensive care at home, for mainly long-term ventilated patients with tracheostomies. So we can definitely help you getting your son home because that's bread and butter for us. How do we do it? We provide intensive care nurses 24 hours a day, 7 days a week to take ventilated patients out of intensive care. We're cutting the cost of an intensive care bed by 50%, but more importantly, we're improving the quality of life for your son, but also for you as a family, because you can finally stop spending day and night in ICU, and I'm sure you're looking forward to going home with the right support. Here's another quick tip, Henry. Your son's got an infection or sepsis even, from a PICC line. That's really disappointing to hear. Some PICC lines can stay in for a month, other PICC lines can stay in for 3 months, and furthermore, they need to have proper dressing changes and they need to be cleaned properly with aseptic technique so they don't get infected in the first place. So I don't know why it got infected. You may want to find out, have they done the dressing changes non-sterile? Have they not cleaned it properly? Has it been in for too long? And also, if you are going home with a PICC line, again, that's part of what we do because we're intensive care nurses. We can change the dressing for PICC lines at home so they don't get infected in the first place. So that's my tip for today. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll talk to you in a few days.